Having a total hip replacement? Be prepared for pain. I had a total hip replacement 2.5 years ago at the age of 56. My doctor acted like, oh, it would be no big deal. I'd be home the same day. Life would be great. What my doctor didn't tell me is, yes, I would be home the same day, but when I got home, I would vomit continuously for 12 hours. What he didn't tell me is that I would have burning pain in my thigh at night for 4 months after the surgery. And he didn't tell me that 2.5 years later, the same pain that I had that originally sent me to him is now back. The medical community acts like a total hip replacement is no big deal. Folks, they cut us open, they saw off part of our bone, they hammer in some type of metal part into that same bone, and then they stitch us up and send us home. And that is if nothing goes wrong. Hi, I'm Pamela, and I created this YouTube channel to be the voice of patients that are actually having hip replacements. Because when I was investigating the surgery before I had mine, I found all kinds of information from doctors, but very little from people just like you and me. Today's video is all about pain issues that real people have based on my situation, the situation of other people who I know personally, and then all of the comments that people just like you write at the bottom of my other videos that I have on this channel. At the time that I'm recording this video, my channel is still small enough that I'm able to read and respond to every single comment people leave under my videos. And so I hear your stories, I hear your fears, and I hear your pain. And that's why I'm here for you today. If you are navigating your own hip replacement journey, I invite you to subscribe to my channel. When you subscribe, if you click the bell icon, you'll be notified every time I create a new video. I have a whole slew of them in my lineup for videos that I have based on the questions that people just like you have asked me. First off, I am not a medical professional, and I am not giving you medical advice. I am here to tell you my story with the hopes that after listening to me, you will have better questions to ask your doctor next time you talk to that individual. So many people have said to me, I'm terrified the surgery is going to hurt. I'm afraid I won't be able to deal with the pain after. Or I even get a lot of people tell me that because of whatever reason, they're unable or unwilling to take what I call the hardcore pain pills and opioids after their surgery, and they're very, very concerned about what their experience might be in that situation. All I want to say is if you're worried about pain, you are not alone. Pain management is a very important conversation to have with your doctor, both before and after the surgery. Your doctor may try to kind of downplay the pain concerns because they don't want to scare you. But if you feel like your doctor is being dismissive to you when you start to question him about pain, don't let that happen. Be insistent that you get your questions answered. For me, the key to my pain management in the first days and week or so after my surgery was to take my pain pills exactly as prescribed. Meaning, if the doctor said take one every 4 hours, I took one every 4 hours. I would set an alarm in the middle of the night so I could take my pain pill while I was sleeping. I would wake up when I was sleeping, take my pain pill, go back to sleep. That way, when I woke up at my normal time in the morning, I was not in pain. I was going with a mindset of trying to stay ahead of the pain, meaning if my pain was on an average of maybe 2 to 3 on a scale of 1 to 10, I didn't want to wait until the pain escalated to a point where maybe it was at a 7 or an 8 and then take a pain pill. Because for me, I knew that if I waited till the pain was that extreme, it would be really hard to knock that pain back down to that level of 2 to 3. And that's why I did take it very, very regularly, exactly as prescribed. My partner actually even made a whole chart for me of when I was supposed to be taking those pain pills. Now, in the first day or so, day or 2 or 3, I was really pretty dopey and befuddled and kind of stunned for lack of better words, from the surgery. Those first few days, he did a really great job handing me my pills on schedule. So if you have not had hip replacement surgery yet, have a good conversation with whoever is going to be there with you in those first couple of days. Talk to them about the importance of their job, being sure that you're taking your pain pills as your doctor prescribes, so that way you don't end up in excruciating agony. If you are somebody who can't or shouldn't take the hardcore pain pills, talk to your doctor about that well before the surgery. You are not the only patient your doctor's had that has that type of situation. They will be able to advise you on different options that might be more available to you based on your own specific situation. If before your surgery you are already taking pain medication for some other problem, be sure your hip replacement doctor understands that. Because what I have heard in a number of the comments from people who have written in response to my other videos is the people who are already on some type of pain management seem to have harder time with pain after their surgery. Now, I'm not a pharmacist. As I said, I'm not a doctor. My hunch is they may have built up a tolerance to pain pills if they've been taking them for a long time. So when their hip replacement doctor kind of prescribed the normal run-of-the-mill prescriptions that they would prescribe for somebody that wasn't already taking pain pills, whatever the hip replacement doctor gave them may not be enough for their needs. Who is likely to have a bigger problem with pain after the surgery versus people who are less likely to have pain after the surgery? Now, I'm talking just regular, run-of-the-mill, ordinary hip replacement surgery, if there is such a thing. I'm not talking about people that had some type of major issue that happened during their surgery. Based on the comments that people have shared with me, it seems like the people who are younger, healthier, and more active before the surgery are the ones that tend to rebound a little bit faster. Now, you may be thinking, well, duh, that's pretty obvious, but it's something definitely that you want to consider, especially if your surgery is planned for months in advance. If maybe you aren't in the greatest shape right now, or maybe you're a smoker, you may consider using the weeks and months between now and when your surgery is actually happening to try and get yourself in the best possible condition you can be before your surgery, so that way hopefully you'll have the best possible outcome after your surgery. Here's a great example of somebody that had a really outstanding recovery. This woman says she never took a narcotic, and she was actually driving her car on day 3 after the surgery. Now, she also says she was a ski instructor, worked in a warehouse loading trucks using ladders, building pallets, and pulling heavy pallets with a hand jack. And so she says, so I'm in good shape. So she is a great example of somebody whose body was prepared to have this type of surgery. Now you can compare her to this other comment that somebody wrote at the bottom of one of my videos. This woman ended up having to call her family doctor several days after her hip replacement surgery because her ortho doctor would not prescribe her any more medication for her pain. She goes on to say, though, that she already had chronic sciatica and was already taking Percocet every day and was already under a pain management plan with her family doctor. After her hip replacement surgery, her family doctor prescribed morphine because that's what her body needed to dull the pain. Now, granted, these are just 2 examples. I have dozens of very similar stories on both ends of the spectrum written by people just like you and me. If you know you have health issues separate from the problem you're having with your hip, have a face-to-face conversation with your doctor about that. Another person left a comment saying that she had lupus and the prescription that the ortho doctor gave her wasn't consistent with what she needed for her lupus, and so she ended up having a whole spiraling downhill effect after her hip replacement simply because of that. The most important thing I can stress with this is be sure your doctor is listening to you when you're talking about these problems. About a month before my surgery, I got an email from the anesthesiologist's office with this whole long questionnaire about my situation that I needed to answer the questions. One of the questions was, do you get seasick? And I said, yes, I get seasick. I've been known to get car sick. I've been known to get air sick. If the airplane's going back and forth too much. My partner actually said to me when I mentioned that to him, he said, I didn't know you get seasick. You don't get seasick. And my response to him was, have you ever seen me on a boat? And he's like, no. It's like, because I get seasick. Now, I filled out that questionnaire. The day before my surgery, the anesthesiologist actually called me. He had all kinds of concerns about my blood work that my GP had done. Didn't ask me at all about the answers to the questionnaire that I had. And next thing I knew, after my surgery, I was vomiting for 12 hours. Looking back, kind of at the end of those 12 hours, I realized I had motion sickness. A couple of weeks later, I was talking with a friend who had just had knee replacement surgery a couple of days before I was talking with her, and I mentioned this motion sickness problem that I was having, and she said, well, why didn't they give you the patch? And I'm like, what patch? I didn't know that there was a patch. She goes, oh, look, right here. My doctor put a patch here. It's the same type of patch that they put on people that are known to get seasick. And that was so frustrating to me because I had thought I had told the anesthesiologist that I get seasick, but I did not have that conversation with him, probably because I did not know that that was going to be a problem after my surgery because I've never had that type of anesthesia before. But I'm sharing that with you because that's a really good example of the importance of having actual conversations with your doctors about your concerns rather than kind of filling it out in a questionnaire that you fill out online or on your itty-bitty smartphone like I did. Be sure that you are looking your doctor in the eye and that they truly understand where you are coming from. Another resource that you might have to help you better understand pain management is actually your pharmacist. Now, your pharmacist most likely won't be able to prescribe a different medication for you, and they may or may not call your doctor for you, but they certainly can help you better understand your pain medication and especially different side effects. Speaking of side effects, what about those people who don't like taking those hardcore pain pills because they make them feel kind of woozy, dopey, slobby, sleepy, kind of like all the unattractive of the seven dwarfs? My partner is like that. He's a very active man. He's broken a number of bones, had a couple of different surgeries, and he virtually refuses to take any of the opioids because he doesn't like how dopey they make him feel. So what he has ended up doing is just toughing it out, which I don't think anybody would recommend unless you truly have a problem with addiction or some other medical reason why you cannot or should not take some type of, doctor prescribed pain pills. If you're one of those people that doesn't like that kind of dopey feeling, talk to your doctor or your pharmacist to find out if perhaps you can simply just reduce the dosage. When my partner had his latest knee surgery, I actually looked at the prescription that his doctor prescribed for him. It was 10 times more powerful than what my doctor prescribed for me after my hip replacement surgery. Now, he's a much bigger man than I am, but he is not 10 times bigger than me. And so I said to him, hey, Bill, maybe you ought to talk to the doctor or the pharmacist. Maybe you don't need a full pill. Maybe you only need half a pill. But by then, he was so concerned about not liking that feeling that he didn't take any. The other thing that you want to be sure that you understand ahead of time is if you're supposed to take your pain medication with food. If you can, talk to your pharmacist about that. Now, what you may find is with food needs to be something more than a piece of white toast with a little bit of butter on it. It may need to be something more than a little cup of strawberry yogurt. You might need to take your pain pills with a legitimate meal, a full-blown meal. And if you don't, you may find that's what's causing you to be a little bit woozy or nauseous or dizzy from your pain meds. Again, talk to your doctor or your pharmacist about that type of thing. I stopped taking my pain pills during the day after about the first week or so, but I had a really intense burning pain in my thigh at night. I could go to sleep with no problem, but then I would wake up with this burning pain. I talked to my doctor about that, and he ended up prescribing a muscle relaxer. And I found that half of a pain pill and half of a muscle relaxer was kind of the right combination for me to help me sleep through the night. Now, the thing that concerned me was I really liked the way that that little half of one pill and half of another pill made me feel. Slept like a baby the whole night. And I talked to my pharmacist about that. And I said, okay, I don't want to take this forever. He's like, oh, no problem. You can take it forever. Plenty of people take it forever. And I remember looking at him going, okay, I thought we had an opioid epidemic in our country, if not the entire world. He's like, oh, it's no problem. You can take it forever. And that's when I said to him, absolutely, I'm not taking it forever. And so I stopped taking that at night as well. Now, what ended up happening, though, is I still had that burning pain in my thigh. It would wake me up in the middle of the night. What I kind of started to figure out was during the daytime, I was somewhat active. Even if I wasn't doing anything truly ambitious, I was still kind of walking around the house a little bit, maybe doing a load of laundry, cooking dinner, going for a little stroll a couple of houses down the street. My body was moving, and I think that really helped with some of the pain relief. But at night, when I wasn't moving, I think that the stiffness really kind of contributed to that deep ache. What I ended up doing was just getting up in the middle of the night, kind of walking around the house sometimes. Sometimes I'd go and sit on the couch, read a book for a little bit, watch TV a little bit. Sometimes I'd fall asleep on the couch. My partner would wake me up, whenever he woke up in the morning. And I just kind of dealt with it. And I probably had that pain for about 4 months after my surgery. A couple of months later, I was talking with yet another friend who had had a knee replacement. And he told me he had the same problem, deep, throbbing, burning pain at night, even though he wasn't having pain during the day. So if that's something that happens to you, talk to your doctor about it. See if perhaps there's a different option for you that may be more effective. I don't recommend anybody take pain pills for the rest of their lives unless their doctor tells them that's the only option. I'm not here to judge anybody if they decide to do that. Just for me, that was not the choice I wanted to make. What about that pain that I mentioned that I had before my surgery and came back 2.5 years later? It turns out the pain that I had that originally sent me to the very first doctor wasn't hip pain. It was actually pain in my groin. It was a strange groin muscle. It was a physical therapist about 9 months ago who finally diagnosed that for me. So I went to the very first ortho doctor telling him that I had this pain in my hip. Of course, the first thing he did was take x-rays. And yes, my hip joint was trashed. I had massive dysplasia. I had deterioration of the femur. Yes, I needed a hip replacement, but fixing the hip joint did not actually fix the pain that I had originally. So that original pain that I had in my groin area, I had it for about 9 months after my hip replacement. At the time, I was actually starting to run a lot with my doctor's approval. And I think having a lot of consistent exercise kind of helped alleviate that pain that I had in my groin. It was gone for, I don't know, maybe about a year or so, and then it came back. And that's when it came back when I saw a different physical therapist who was the one who diagnosed that groin pain for me. So that's kind of a whole different story. However, the point here for you is when you are sitting down talking to your doctor about what's going on with your hip, whether it's your pain or if it's grinding that you're having, be sure that you are as clean and clear and descriptive with your doctor of exactly what is going on with your body. Your doctor can look at x-rays and he can make decisions based on his medical training, looking at your x-rays, but it's your body. And just because your x-ray shows one thing, that may be not necessarily reflecting the level of pain that you might have before your surgery or even after your surgery. So be sure that you are as descriptive as you can be with what's going on when you sit down and see your doctor eyeball to eyeball. Don't let your doctor just control the conversation. It's your body, your hip, surgery's happening to you. You need to be in charge of that conversation. After your surgery, if you are still in pain and whatever the doctor has prescribed for you is not doing it for you, call your doctor right away. Don't wait for the 2-week checkup that they already scheduled for you. If you had a total hip replacement and you're in pain right now, or if you're planning the surgery and you're worried about what pain might be to come, I hear you. I'm here for you and I understand the problems that you have. If you're concerned about the pain, you're not being weak, you're not being dramatic, you're being a human being. Every hip replacement journey is different, and pain is going to be different for every single patient out there. But the more that we kind of all talk about it as a patient community, the better it's going to be for all of us, as well as other people who we have not yet encountered who are concerned about the exact same things that we are. And that's what this YouTube channel is for, to be a community of people going through a very similar experience. If this video helped you in some way, or if you think it might help somebody that you know, please give it a thumbs up. And if you want more honest, unfiltered conversations about what it's like to have a total hip replacement, please subscribe to the channel. And again, tap that little bell icon. That way you'll be notified every time I release a new video. Thanks for being here with me today, and I'm rooting for you.